Welcome back, everyone, to Hyperbaric Talks for another deep dive into the world of HBOT.
I'm excited.
So, last time we, laid the groundwork, talked about the basics of HBOT.
Right.
We're picking up right where we left off.
Absolutely.
We've got, a stack of research here.
Yeah.
And we're trying to extract the most important nuggets for you guys.
Exactly.
And today, we are tackling how HBOT can help manage chronic pain.
Yeah, there's so much potential there.
So, I know last time we talked about the basics, but maybe for anyone just tuning in,
Sure.
Can you give us a quick, just the basics of what happens inside a hyperbaric chamber?
Yeah, so HBOT involves breathing pure oxygen in a pressurized environment.
Yeah.
And typically that pressure is 1 to 3 times higher than just the normal atmospheric pressure.
Okay.
So you can kind of imagine yourself like submerged in an environment of pure oxygen instead of water.
Oh, okay. Like a high-tech oxygen bath or something.
Yeah.
But how does that actually help pain?
Right.
That seems kind of counterintuitive, right?
Yeah, it's fascinating because HBOT doesn't just mask the pain.
Okay.
It really tries to go after some of the underlying causes.
Okay.
And it does this in a couple of ways.
Okay.
One of the primary mechanisms is breaking this hypoxia pain cycle.
Okay.
And what that means is that, a lot of chronic pain conditions actually involve areas of low oxygen in the tissue.
Right.
And that actually triggers these pain signals.
Makes sense.
So HBOT floods the body with all this extra oxygen.
Okay.
And it counteracts that low oxygen or hypoxia and can actually disrupt those pain signals.
Oh, so it's like hitting the reset button on those pain signals by addressing like a root cause.
Exactly.
Okay.
That's one of the really cool things.
That's fascinating. So what else?
Yeah, and the increased pressure can also reduce swelling or edema,
Okay.
which we know contributes to a lot of pain.
Right.
It's almost like you're gently squeezing out excess fluid from these tissues.
Interesting.
So you're addressing the low oxygen and the swelling.
Yeah.
Okay. Kind of a two-pronged attack there.
So we're talking about like low oxygen and swelling.
Right.
What else is going on at like a cellular level?
Well, we can't forget about healing.
Okay.
Oxygen is essential for tissue repair, and HBOT can actually accelerate that process.
Oh, okay.
So it's kind of like giving your body's repair crew a turbo boost.
I like that. So it's not just about reducing the pain, it's about promoting healing
Exactly.
in those damaged areas as well.
Exactly.
Okay.
And, there's also research ongoing into the role of nitric oxide
Okay.
in HBOT's effect.
I've heard of nitric oxide.
Yeah, it's a molecule that helps to regulate blood flow and inflammation.
Okay.
And some studies suggest that HBOT may actually increase nitric oxide production,
Interesting.
which is pretty exciting because it could further contribute to the therapeutic benefits.
So it's like HBOT is like a multi-tool for pain management.
Yeah.
Reducing hypoxia,
Yeah.
reducing swelling, promoting healing, and maybe even, influencing these nitric oxide levels.
Yeah, and we're just scratching the surface there, I think.
Wow. Okay, well, let's get specific because
Okay.
in our research, we highlighted several chronic pain conditions
Right.
where HBOT has shown promise.
Yeah.
And one that stood out to me was fibromyalgia.
Huh.
Can you tell me a little bit about how HBOT can help individuals with fibromyalgia?
Yeah, fibromyalgia is characterized by, widespread musculoskeletal pain,
Okay.
fatigue, tender points throughout the body.
I've heard it's really debilitating.
Oh, it's incredibly challenging to manage. And what's encouraging is that studies have actually shown that HBOT can reduce the number of tender points,
Wow.
lower those pain scores, and increase pain thresholds in individuals with fibromyalgia.
So they're able to handle the pain a little bit better.
Exactly. Imagine having fewer points of pain and being able to tolerate pain better.
Right.
That's a huge improvement in someone's quality of life.
Absolutely. Okay,
Yeah.
so it sounds like HBOT is really giving those with fibromyalgia some much-needed relief.
Definitely.
Another condition that caught my eye was complex regional pain syndrome.
Yes.
Or CRPS.
CRPS.
This one sounds particularly difficult to treat.
Uh-huh.
What have you learned about HBOT's potential in this area?
Well, CRPS is a really tough condition.
Yeah.
It involves severe pain, often in the limbs.
Okay.
And there are changes in skin color, temperature, and swelling.
Wow.
And research suggests that HBOT can be really quite effective in reducing both the pain and that edema in these CRPS patients.
So it's going after those root causes again.
Exactly, that hypoxia and the swelling.
Instead of just masking the symptoms.
Exactly, it's a very targeted approach.
Wow. Now, I know a lot of people out there
Yeah.
struggle with debilitating headaches, like migraines and cluster headaches.
Yeah.
Is there any hope for them in the world of HBOT?
You know, there is.
Yeah.
Research on HBOT for headache disorders is really exciting. Okay. Some studies have shown that HBOT can provide relief during migraine attacks
Yeah.
and potentially by constricting blood vessels in the brain,
Okay.
which helps to alleviate that throbbing pain.
So it's almost like a counter pressure
Yeah.
to those dilated blood vessels.
Exactly, yeah.
That's fascinating.
Yeah,
What about cluster headaches?
right.
Those are supposed to be like notoriously painful.
Yeah, they're really notoriously painful.
Yeah.
But here's where it gets really interesting.
Go ahead.
HBOT might not only offer relief during those attacks,
Okay.
but it also might reduce the frequency of the attacks.
Oh, wow.
So almost like a preventative measure.
So that's like, prophylactic in a way.
Yeah,
Wow. That could be life-changing.
it certainly could be.
Yeah.
But, while these findings are promising, we need more research
Yeah.
to confirm these findings and really establish clear treatment guidelines for headache disorders.
Of course. Of course.
Yeah.
Okay. So we've talked about fibromyalgia,
Yes.
CRPS, and headaches.
Right.
What about myofascial pain syndrome?
Yeah.
Or MPS?
MPS.
This one involves those trigger points in the muscles
Yeah.
that cause pain
Yeah.
and can refer pain to other areas of the body.
Exactly.
Does HBOT hold any promise for this condition?
While the research on HBOT for MPS isn't as extensive as for some of these other conditions,
Okay.
there are some preliminary studies
Okay.
suggesting it might increase pain thresholds and decrease pain intensity
Okay.
in MPS patients.
So it's definitely an area worth exploring further.
Absolutely. Yeah.
It's encouraging to see, these initial positive results
Yeah.
across such a diverse range of chronic pain conditions.
It really is.
Now I'm curious about the practicality of HBOT.
Yeah.
What types of chambers are out there?
Right.
And is there any possibility for at-home treatment?
Yeah. So there are two main types of chambers.
Okay.
Monoplace chambers,
Okay.
which are designed for a single person, and then multiplace chambers, which can accommodate multiple people.
Right.
And as for at-home treatment,
Yep.
that's becoming more of a reality.
Oh, wow.
Hyperbaric chambers that operate at pressures up to 1.5 ATA can be safely used in a home setting.
So people could potentially manage their pain
Yeah.
from the comfort of their own homes.
Yeah.
That's amazing.
It is.
Now, of course, that would have to be under proper medical supervision, right?
Of course, proper training and supervision are essential.
Absolutely. Okay.
Yeah.
So we've covered a lot of ground today,
We have.
from the mechanisms of HBOT
Uh-huh.
to its potential applications
Yeah.
for various chronic pain conditions.
Right.
And it's been very eye-opening.
Yeah, me too.
But I want to dig even deeper into the research behind HBOT.
Okay.
What do you say we shift gears and explore some specific studies that support these findings?
I'm all for that. Yeah, let's get into the details.
Okay, great.
Okay, so let's get into some of the research
Yeah, let's do it.
that really backs up these exciting claims about HBOT for chronic pain.
All right, where do we start?
Well, remember we were talking about the potential of HBOT for fibromyalgia?
Yeah.
There's a really fascinating study from 2004
Yeah.
that was published in the Journal of International Medical Research,
Okay.
and they looked at 50 patients with fibromyalgia.
Okay, so 50 patients, that's a pretty decent sample size.
Yeah.
What did they do exactly?
So they divided these patients into two groups.
Okay.
One group received 15 sessions of HBOT over 5 days,
Okay.
with each session lasting 90 minutes at 2.4 ATA.
Okay.
The other group, the control group, breathed regular air at normal atmospheric pressure for that same amount of time.
So one group got the full HBOT experience.
Right.
And the other group was like a baseline for comparison.
Exactly.
Okay, so what did they find?
The results were pretty amazing.
Okay.
The HBOT group saw a significant decrease in the number of tender points compared to that control group.
Right.
And not only that, but their pain scores measured on a visual analog scale also went down,
Okay.
and their pain thresholds actually increased.
So fewer tender points, less pain overall,
Yeah,
and a higher tolerance for pain,
right.
all thanks to HBOT.
Exactly.
That's really compelling.
It is.
Now, remember we were talking about complex regional pain syndrome
Yes, CRPS.
or CRPS?
Yes.
I mean, this one sounds really difficult to manage.
It is.
So I'm really eager to hear about this one. How did they study HBOT's effects?
So this was a placebo-controlled study,
Okay.
meaning they had a control group that received a sham treatment to compare
Okay.
against the actual HBOT group.
Gotcha.
They enrolled 71 CRPS patients
Oh.
and randomly assigned them to either 15 sessions of HBOT
Okay.
or 15 sessions of breathing air at 2.4 ATA.
So they're both in a pressurized environment,
Right.
but only one's getting the pure oxygen.
Exactly.
Okay.
It helps to isolate the effects of the oxygen itself.
Makes sense. What did they discover?
Well, the researchers found that the HBOT group experienced a significant reduction in both pain and swelling compared to that placebo group.
So again, like HBOT is addressing those core issues.
Yes.
The hypoxia and the edema
Mm-hmm.
that really drive CRPS.
That's right.
It's a targeted approach.
It is.
Okay, let's shift gears to headaches.
Okay.
There's been a lot of research on HBOT for both migraines and cluster headaches.
Yeah.
One study that I thought was particularly interesting on cluster headaches
Yeah.
was conducted in 2002 and published in the journal Cephalalgia.
Okay.
And this was a double-blind, placebo-controlled study,
Wow.
meaning neither the patients nor the researchers knew who was receiving the real treatment.
That's the gold standard.
How did they set up the study?
All right, so they had two groups of patients.
Okay.
One group breathed pure oxygen for 70 minutes at 2.5 ATA,
Right.
while the other group breathed a mixture of 10% oxygen and 90% nitrogen at the same pressure.
So they're controlling for the effects of just the pressure itself.
Versus the pure oxygen.
Exactly.
That's clever.
Yeah, it's a good design.
What were the results?
Well, interestingly, both groups showed a response to the treatment. And there was no significant difference between the pure oxygen group and the mixed gas group.
That's a little unexpected.
Yeah, a little bit. What could that mean?
Yeah, what could that mean?
Well, it suggests that the pressure itself might actually play a role in relieving cluster headaches.
Interesting.
However, we definitely need more research to fully understand what's going on.
Right.
And how the pressure and the oxygen might be working together.
It's like a puzzle.
It is.
Trying to figure out how all these different pieces interact and influence pain.
Absolutely.
And you mentioned migraines earlier.
Yeah.
What does the research say about HBOT for migraines?
So there was a fascinating study published back in 1995 in the journal Headache.
Okay.
And this one compared the effectiveness of 100% oxygen delivered under what we call normobaric conditions.
Which is just normal atmospheric pressure.
Okay.
Versus hyperbaric conditions at 2 ATA.
So regular oxygen therapy
Yeah.
versus HBOT.
Exactly, a head-to-head comparison.
Oh, I like it. Okay.
Yeah.
What do they find?
All right, so they enrolled 20 migraine sufferers
Yeah.
and randomly assigned them to either the normobaric or the hyperbaric group.
Okay.
All participants inhaled oxygen for 40 minutes in a chamber,
Okay.
but they were blinded to the pressure level.
That makes sense. So you eliminate any bias.
Exactly.
Okay. So what
The
happened?
results were quite striking.
Okay.
Only 1 out of 10 patients in the normobaric group
Oh,
experienced relief from their migraine,
okay.
but 9 out of 10 patients
Wow.
in the hyperbaric group saw significant improvement.
That's a huge difference.
That's a big difference.
Breathing pure oxygen at normal pressure versus under pressure.
Yeah, it really highlights that power of the hyperbaric environment.
Wow. Okay, this is all so fascinating.
It is.
We've covered studies on fibromyalgia,
Yeah.
CRPS, cluster headaches, migraines.
Uh-huh.
Is there any research on HBOT for myofascial pain syndrome?
Yeah.
Or MPS?
There are some interesting studies on MPS,
Okay.
but as you mentioned, not as extensive as some of the other research.
Okay.
One unpublished study involved treating 20 MPS patients with HBOT.
Okay, what did this study reveal?
So they used a technique called algometry
Right.
to measure pain thresholds.
Okay.
And they used the visual analog scale to assess pain intensity.
Gotcha.
And after the HBOT treatments, they observed a significant increase in pain thresholds
Okay.
and a decrease in those pain scores.
So it seems like, similar to the other conditions,
Yeah.
HBOT is increasing people's tolerance for pain
Right.
while also reducing how intense the pain feels.
Exactly.
That's really fascinating.
It is.
But, it's important to emphasize that
Yeah.
more research is needed
Always.
to confirm these findings
Yeah,
and determine, the most effective treatment protocols for MPS.
for sure.
More research is always a good thing.
Absolutely.
It's really encouraging to see these positive results
Yeah,
across such a diverse range of chronic pain conditions.
it's really promising.
Now, I can't help but wonder about the future of HBOT.
Yeah.
Where do you see this field heading? It feels like we're really, on the edge of something huge with HBOT.
Yeah, it's exciting.
Where do you see the field heading in the future?
I think as research progresses, we're going to discover even more applications for HBOT.
Okay.
And develop more refined treatment protocols that are tailored to, specific conditions and individual patient needs.
So really like a personalized approach.
Absolutely, because, not everybody responds to treatments in the same way.
Of course not.
Right? So having those tailored options can really make a world of difference.
It can really change someone's life.
Right.
And, we were talking about the possibility of home-based HBOT becoming more accessible. I mean, we might see a shift towards more, integrated and convenient treatment options for chronic pain.
Absolutely.
Imagine being able to manage your chronic pain from the comfort of your own home.
It would be amazing.
Under proper medical supervision, of course.
Of course, yeah.
But still, I mean, what an incredible leap forward that would be.
It would be revolutionary for a lot of people.
It really would.
Yeah.
Of course, there's still hurdles to overcome.
Right.
We need more research to fully understand those long-term effects of HBOT.
Right.
And to optimize treatment protocols.
Yeah.
And to really address any potential safety concerns.
Of course, yeah.
It's important to approach any new medical treatment with a balanced perspective. Right?
Absolutely.
Consider the benefits, but also the risks.
For sure.
And I think, open communication between patients, clinicians, and researchers is going to be key to advancing this field responsibly.
Sure.
And ensuring, that HBOT is used appropriately and effectively.
Couldn't have said it better myself.
Well, this has been an incredible journey exploring the world of HBOT with you today.
It has been, yeah.
We've learned so much about how it works, the potential benefits, and the research that supports its use for managing all these different chronic pain conditions.
It's exciting stuff.
It really is eye-opening.
Yeah.
Any final thoughts you'd like to leave our listeners with?
I would encourage everyone to stay curious about new and emerging treatments like HBOT. And if you're struggling with chronic pain, don't hesitate to explore all of the available options with your healthcare provider.
That's such great advice.
Yeah.
And to our listeners, thank you for joining us.
Yes, thank you.
On this deep dive into the world of HBOT for chronic pain management.
It's been fun.
We hope you found it informative and engaging.
Yes.
And we'll see you on the next episode.
All right, see you then.
Of Hyperbaric Talks.